Adam Zapata, the student, and today I am here with Miss Gretel Aguilar, LVN. Has been a nurse already going on 4 years, has experience in a hospital setting working with the elderly and as well as working in a nursing home with them. And today, Ms. Gretel, we will be discussing this phase in life, which would be late adulthood. And I have two questions for you. The first one we can start with is, do you believe that elderly people stress more over the fact that they are physically declining, or or it's the stress that comes with knowing that they must depend on a family member or a provider to help them do normal activities of daily life, in your experience?
Honestly, from what I can say from my personal experience, is that it's really a mix of both. It really just depends on your patient. Um, from what I have seen and learned, the loss of independence tends to hit harder emotionally. If a patient tends to be more independent, usually I think it would hit them the hardest not being able to do things themselves.
In a sense that at some point, they were walking and talking by themselves, not needing to ask for help, and now all of a sudden it's, hey, I can't do this without your assistance, whether that be the provider or the family member.
Yes, pretty much. So they get weaker, they get slower, sometimes they're in pain, and then the simple things just become difficult. Um, I feel like a lot of elderly patients actually expect some of that, as I mean we all expect it as we get older, but for them it's just their bodies not being how they used to be. And then I also think that they don't always accept the help they need. They try to maintain that independence on their own.
So it's a constant battle between, in a sense, like I want to do it myself, but I also know that if I do it by myself, I could possibly injure myself, in a sense.
Yes. So from a nursing perspective, we try to help them with their activities of daily living, like bathing, getting dressed, or using the restroom. And a lot of people, I would especially say opposite genders, want that privacy. And like you said, it's very difficult when someone is weak, isn't able to be full weight bearing, or whatever reason they can always potentially fall. We have patients on blood thinners. We have patients who are not all there. They're not alerted into times 4, so they don't know what exactly they're doing.
I'm glad you stated the not always there and, alert and orientated times four. That'll be backpacking on to the next question I have for you, but you can continue on this one. Okay, fine. Then I guess that's all you have. We can go to question number two, which, cognitively speaking, on the elderly, what have you experienced? Is the patient truly ever aware that they're slowly developing maybe the Alzheimer's or the dementia? And if so, how do they respond to kind of always knowing that they're in between, I guess you would say being alert all the time, or or kind of like I'm in a daze and what happened? Where was I for a specific period of time?
Actually, Adam, can we just jump back into the other question before I answer this next question?
Okay, that's fine.
So, obviously, when patients don't feel like they can have their sense of independence, they do tend to feel like burdens for family members.
Okay.
So, patients will sometimes say, I don't want to bother you, or my daughter already does this much for me. And even when we're trying to support them, they always hesitate to ask for help, because they just don't want to feel like they're taking something away from themselves, such as their independence, obviously.
Okay.
And then there's that role of reversal, um, which is imagine being a parent and you're taking care of your children, and now they have to take care of you. And I don't think that's a good feeling as we get older. I think we're aware, but we're not ready to embrace it when it does come.
Okay. Okay.
And then speaking to your next question, which was,
Oh, I'm sorry. I can reset. I'm sorry. So on the cognitive side of it, speaking on the elderly, what have you experienced when they begin to slowly decline cognitively and mentally? Whether they could be at risk for heading toward the Alzheimer's or possibly some sort of dementia or delirium. Are they aware that sometimes they're not all there? And if so, how do they respond to that? Sorry.
for this question, I think it's a very complex answer. I think that they are aware in the moment that they are fully there, but I feel like they zone in and out of those moments. But majority of the time, they more than likely won't know what's happening. So I believe that they are aware in the early stages, not so much as, the dementia or Alzheimer's starts to progress. From what I've seen, patients in the early stages are often very aware. They notice small changes first, like forgetting their name, repeating questions, misplacing things, and to them, they just label as being forgetful.
Okay.
And slowly and progressively, obviously, things get worse and they start being more aware until they don't.
Okay. So it's like you say in the beginning, it can be considered forgetfulness, or I would say that maybe you I'm not gonna say you repeat to them, but you kind of give them I would say like a hint or a little push, like we've already been through this.
Yeah, reminder.
How are you feeling? Is everything okay? And then of course, like you say, as they get toward the late stages of the disease, they kind of just like they're in that delirium state where they're kind of just they don't know what's going on. I hate to say it like that, but
Yes, it's true. Well, like from our experience, or my personal experience, sometimes they get frustrated. They don't know the right words to use. They don't know what's happening. They get lost mid conversation. And you can see the moment when they finally recognize what happened, and it tends to bother them. And sometimes they'll laugh it off, or, stay quiet or withdraw from the conversation. So unfortunately, it's just something that happens, and then they also try to hide it, especially from family members. They don't want to upset anyone, they don't want to worry anyone, and they'll avoid those conversations. And they'll rely heavily on their own routines so that they don't think, something is wrong.
okay. So this is kind of the conclusion. So just to reiterate what you said. So primarily when it comes to the physical decline, they just don't want to feel like they're a burden. So now we have the stress of I want to stay independent, be my own person, but sometimes they're like you said, they're in between that middle ground of I don't want to be a burden, but I also know I can't do this, so I have to ask. And I'm sure that's just as much stress as it is having to accept that they're no longer independent, and then the stress of I guess trying to find I think we can also agree that sometimes trying to find a reliable provider or family member to always be there can also be part of the stress as well. And then going into that second question, concluding that it is, it's in the beginning, it's like you say, forgetfulness, kind of haha, I know for a second I wasn't all there, and then toward the end they're kind of just,
I feel like they're lost.
Yeah.
Like they're no longer there.
Okay, Gretel. Well, I can appreciate your time, and thank you for your outlook. Okay.
Thank you.